We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
It's been nearly a month since the World Health Organization declared the COVID-19 outbreak a global pandemic. Now, since that time, there's been an absolute deluge of information from all fronts about what's happening and what people think going forward.
We need every American to continue to do their part, and we will hasten the day that we put the coronavirus in the past.
But we wanted to go directly to the source, so we reached out to Dr. Margaret Harris of the World Health Organization's Coronavirus Response Team to see if she can give us some answers on the burning questions that are happening today and also on what she thinks will happen going forward. Dr. Harris, thank you so much for taking the time today.
That's a pleasure to be with you.
Maybe you could delineate what is the exact role of the World Health Organization during this crisis?
So our role is multiple, but it's really to coordinate, to collect all the information, understand right from the beginning for any outbreak, what is the nature of the illness it causes in people, how is the virus transmitted, how can we treat it, and bringing all the scientists together, finding out what are the big questions we need answered and putting them to work. We also have found ourselves becoming the suppliers to the world. We've had to supply all the personal protective equipment, the tests, oxygen, because it's really about bringing the world together to fight this virus.
I think if you talk to health experts or epidemiologists or virologists, they said, look, we saw this with SARS, we saw this with MERS, yet there's a sort of shocking lack of preparedness in many countries, the United States being top among that list.
What am I going to do with 400 ventilators when I need 30,000?
Why, if we knew this was coming, did we not prepare?
I think it's human nature. When first reports came out of this virus, about this virus, remember it took a month to kill anybody.
Health officials seem to think it is only a matter of time until the coronavirus starts to spread through communities here in the United States.
Because it took a long time to get the ability to really race through populations, and because a large percentage of people had what's called mild to moderate disease and didn't need the hospitalization, many people thought, another flu.
This thing may plateau out within a few weeks and not be as bad as it may have been portrayed.
But I do want America to know that the risk right now is low.
More like a severe flu season in terms of the interventions and approaches you see.
So nobody took it terribly seriously. Now, one of the things that suggested, certainly to me, but to many others, that this virus was a huge concern was that it caused severe pneumonia. So while, yes, we were warning from a very early stage, we declared a public health emergency of international concern, actually at the end of January, it is understandable that some of our warnings were left unheeded.
Many more people will likely die from the flu in this country this year than will even get sick from coronavirus.
We actually described something called Disease X a couple of years ago, and we were laughed at. People would say, what on earth is WHO saying? So for us, we have been preparing.
We had a bit of let's say, a window. We saw it happening in China, then in South Korea, Hong Kong, yet we seem to be handling it poorly. America today has more cases than, I believe, anywhere in the rest of the world. Why is that, A? And B, are there countries that handled this pandemic well, and are there countries that handled it poorly?
So I think what's happened in the US is what's happened in Europe, but just on a much larger scale, because you have huge cities, you have huge populations. It seems authorities took more of a flu position, that you could test a few people and then you'd understand where the virus is in your community. But this virus is not flu. It is stoppable if you really, really test a lot of people. But in order to be doing the testing, you have to have set up your teams, trained your teams, set up your laboratories, trained all your laboratory staff, got yourself an information system, and that all takes a lot of commitment to the decision to test. And that's something you do well before the virus arrives, and that's something that other people might say to you, what on earth are you making all this fuss about? So for authorities to have gone in that direction may have been a difficult sell.
That brings up the next point, which you mentioned testing. But why didn't we have tests? Why didn't we have any testing capabilities? I understand you don't work for the American government and you don't want to piss off one of your biggest funders, but it's a big question that everyone in America is asking. Why don't we have tests?
So that was a decision, clearly. And again, you're it's like the most advanced health system in the world, right? You've got fantastic science, you've got fantastic scientists. Now, normally we worked with different laboratories to develop tests. So that testing and the development of the testing was done locally in the US, as is appropriate, and many other countries developed their own test. I'm not going to get into what didn't go so well because I actually don't know, but that's why those decisions went in that direction.
Yeah, I think there's a lot of frustration because we see, let's say, China, South Korea, Hong Kong, Singapore, able to flatten the curve. And it kind of is like we threw up our hands and said, well, we're going to be so much worse than China, South Korea, Taiwan. And there's a lot of people scratching their heads saying, hold on, we have all of the tech, we have all the doctors, we have the best healthcare system, yet we can't stop this thing? Why?
Yeah, the focus really needs to be not comparing yourself with other countries, but one of the advantages South Korea, Hong Kong, Singapore had was they experienced SARS.
Within 24 hours, their hospital will be entirely devoted to SARS patients.
So what we're seeing now in many countries, the empty streets, the economy tanking, all those things happened to Hong Kong and Singapore in 2003, and they have not forgotten. I mean, before 2003, it was normal to see people spitting in the streets in Hong Kong. You just don't see that anymore. These are societies that are aware of what a pathogen like this arriving in your society can do, and who really heeded the warnings and took action very early.
So you said something there that's very interesting, that the World Health Organization kind of knew this was coming, called Disease X, and warned world leaders, and no one paid attention. Now, is that because supranational entities like the World Health Organization are sort of viewed with, skepticism?
We give the organization about $58 million every year. That's double what any other country donates for some reason.
They are a corrupt and frankly useless organization, not unlike the United Nations from my perspective.
Is it a sort of political game? I know that there's been a lot made out of the Japanese and Taiwanese officials are calling the World Health Organization the Chinese Health Organization because of friendship with China or cozying up to China. But you said that there was a disease X coming. You called that this was going to happen, and a lot of people ignored you. Why?
I think several things. Genuine preparedness takes a lot of work. Now, a lot of the preparedness work we've done in less well-resourced countries. Perhaps there was too much of an assumption that the wealthy, well-resourced, strong health systems would be fine on their own. These guys know what they're doing.
And we have so many people in the hallways that are all COVID positive.
But I think also there's a bit of a beauty contest issue here. When we say, listen, guys, this is a big threat. You've got to take it seriously. You've got to spend budget on your health systems. You've got to spend budget on preparedness. They're like, yeah, well, they would say that because they're about health. They're out there carrying on, crying wolf. And the lack of preparedness has, in many ways, led to much greater outbreaks than anybody would have wanted to see.
You would think that now we will look at new ways of preparing, and so that we can, respond better in the future. What does the new normal look like? This isn't going to be the end of COVID-19, or indeed other pathogens that will lead to other pandemics.
So for us, we think the new normal should look like a much fairer society in terms of access to healthcare. We're talking about everybody being able to get good healthcare, good health advice, treatment if they need it, and essentially being able to access healthcare without destroying themselves financially in every part of the world. I actually think that is the only way forward. It's the only answer for all of us. It's as if nature's saying to us, guys, you've been in a fantasy world. Now get serious, or the viruses will win.
Dr. Harris, thank you for your work, and also thank you for your time today.
That's a pleasure.
On Tuesday, April 14th, 4 days after we filmed with Dr. Harris, President Trump instructed his administration to halt funding to the WHO. Now, it's not clear if Trump actually has the authority to stop these payments, which have to be authorized by Congress. However, the White House says that the president has several options to withhold funding without congressional approval.
This terrible tragedy with the coronavirus show all the limitations of the populism and the nationalism in Italy.
US has the highest number of cases in the world now. It's just past 500,000.
Even though the coronavirus started in China, two of the countries that have been hardest hit are Italy and the United States. In fact, world leaders are referencing the similarity between what's happening in Italy and what's happening in America.
That death toll higher than any other country. In fact, it has just surpassed Italy.
And since there's a lot of information coming out of Italy, a lot of lessons to be learned, we wanted to talk to people on the ground there. So we're talking to the youngest ever Prime Minister of Italy, Matteo Renzi, who is currently the senator for Florence. He's very vocal about proposed solutions to the problems that are happening in Italy and in Western Europe at large. So we're going to talk to him and figure out what lessons can be learned from Italy and what hope we have going forward. Mr. Ex-Prime Minister or Mr. Prime Minister, thank you very much. Senator.
Matteo is better.
Thank you, Matteo. I appreciate the time.
It's a pleasure.
So let's get right into it. What is the situation on the ground in Italy right now?
The situation is very difficult. It's very hard to accept, particularly the old people, grandfather, grandmother. And this is a tragedy. Really, coronavirus killed a lot of people in Italy, also some friends of mine. It's terrible die in the silence, without friends. We cannot accept this tragedy.
A lot of people are saying, a lot of experts are saying Italy matches the American problems most closely. And so if you had one thing to say to people here in America who are watching Italy saying, well, maybe they're flattening now, or this happened in Italy, maybe it's going to happen in America. What lessons can you give us, or what do you want to tell the American people from what you've learned over the last few months in Italy?
I think now it's not time for lessons. When Italy decided to lock down, I spoke to some American journalists who look at us as strange and crazy animals. What happened in Italy? And my humble suggestion was, please be careful. Please, the cross of today in Italy will be the cross of tomorrow in USA. And unfortunately, that happened not only in USA, but also in Spain and France. So now it's time to study all together a global reaction and the global rules for new normality. My opinion is coronavirus will be a problem for the next 2 years.
You've gone on the record to say, look, we need to reopen Italy. We want to have kind of a license for work or travel based on so-called immunity or antibodies. And you propose opening the schools as soon as May, which obviously is a controversial statement, and experts are saying that's wrong. What is the theory behind that? How do you reconcile that?
It's very hard, particularly in Italy, accept a separation between generations, because we Italians, our place is the square. I believe the separation between generations is the first step to give the possibility to come back to work. For example, a passport for COVID. Because if we will be able to discover 10% of population are infected from coronavirus, but without symptoms, that is a revolution, because that part of population maybe are ready to fly, to stay with older without masks.
So you've been quoted as saying, and I'll quote you now, Italy cannot hibernate for another month because that's how social revolt ignites. The balconies will soon turn to pitchforks and the songs of hope to desperate protests. Why would you say that you think that that's going to switch into social unrest and to riots in the next few months?
Please, first of all, let me underline the great reaction of Italian people. Italian people show, and after 1 month, an unbelievable resilience, as in every moment Italian people are used to show. Let me be frank with you. This terrible tragedy with coronavirus show all the limitations of the populism and the nationalism in Italy. In Italy, a lot of people used to say, we have to close the border, we have to block migrants, and we have to fight against globalization. My 2 cents. That message is very stupid, because if you block the border, first, not tourism. For example, in my beautiful city, as Florence, or Venice, or Rome, or Naples, or Milan. Second, not export. Export is one of the most important parts of our GDP. The point is that we cannot continue to follow the slogan, the short message, without a complexity. Politics is the kingdom of complexity.
Now, in the last recession, everyone was worried about Greece and a little bit about Italy going bankrupt. You talked a little bit about the lack of tourism, the lack of exports. And if they both dry up, does Italy go bankrupt? And then with problems in Germany and problems in Spain, they won't have the money to bail Italy out, and then therefore we have a problem with the whole EU. What happens in the economic future for the rest of the year in Italy and the EU?
I think it's very important today to guarantee liquidity to Italian entrepreneurs, because the real problem is not 2022, 2023. The problem is guarantee liquidity now, because if you have an hotel, a restaurant, today you need the money to have a bridge from today to 2022. And that is the most important thing in discussion exactly in those hours in our public debate. For Europe, the great challenge is create a more stronger union. My dream is work for United States of Europe. This is the dream of my generation. And maybe a tragedy as coronavirus will force to discuss about the future of European institutions. I believe in the new generation, in millennials. I want to give them a message. Please don't wait. You are the revolution.
We have a large group of millennials who are just getting back on their feet after the last economic recession, and they've had the rug pulled out from under them again. You have Gen Z, which is the largest cohort globally right now, who are coming of age politically, if you will. And, there's a lot of anger. And then this is just exacerbating a lot of those problems. Leaders are talking about post-corona, what does the world look like? What does the world look like?
I think I agree with you about the angry reactions of a lot of the millennials. But at the same time, if I try to enlarge the camera and study the history of, for example, Europe, in the history of my country and in the history of my city, Florence, Renaissance was the reaction to plague of 1348. Florence lost 2/3 of the people. But after pandemic, Florence created the Renaissance. I believe in the new generation, in millennials. I want to give them a message. Please don't wait. You are the revolution. You are the men and the women, the boys and the girls who really could change the history of the world. And after a pandemic, that maybe is easier.
But what happens if COVID-19 follows the pathway of, let's say, the Spanish influenza, where in the spring some people died, then it died down in the summer, and then that winter you have just a tremendous, death toll of nearly 50 million people. What does the new normal look like if Corona continues and maybe it goes in waves as they're predicting now, where you have a fall off like you're seeing in Italy, but then it ramps up again? What happens to Italy then?
It's not easy to imagine the future and to write the future without a scientist approach. The new technologies will help to fight against virus. I continue to be an unbelievable optimist because the quality of researchers, the quality of scientists, the quality of innovators will help to kill that virus, or more correctly, to transform that virus in a normal problem and not in a killer. Of course, we need time, we need money, we need vision, we need patience, we need hope. I think we will have an unbelievable energy. Billions of people are blocked in the house. You can suppose what type of reaction when finally we come back to embrace, we come back in our square, we come back to concert, to events, to stadium, to sport. I believe will be wonderful, and we will learn how many important that things are for us.
Mr. Senator Matteo, Mr. Ex-Prime Minister, thank you for your time today. We really appreciate it.
Thank you.